I think to be a good doctor, you have to sacrifice. You have to sacrifice of your time, and you have to put that patient that's in front of you above anything else at that time. And that's a challenge because, when you think about the importance of family in our lives, sometimes you sacrifice your time with your family for those patients. But you have to. That's the only way that you can put your heart into it. I always knew that I wanted to be in medicine. I always knew that I wanted to be a doctor. I can't tell you when that desire started or when that interest began, but it was always something that I was, in a way, destined to do or wanted to do. My initial interest in medicine was to do transplant surgery, and ultimately that changed after some experiences that I had with pediatric surgery, and I fell in love with that specialty, and here I am, and I'm just very blessed to be doing this and happy that I made this decision. The most common pediatric surgical procedures that you're going to find are going to be things like acute appendicitis or inguinal hernias. One of the true beauties of pediatric surgery is just the broad scope of practice. Not only the disease processes, but also the ages. We'll take care of babies that were born today up until their early 20s even. The idea is we can even take care of them before they're born, and that's the future, and that's where we want to go. Many of the things that are done on fetuses, while still, of course, within the womb, are going to be procedures for twin-twin transfusion, laser ablation, and so forth. Those are things that are within the realm of the maternal fetal medicine specialists. Some of the more advanced areas are actually going to be taking care of things such as neural tube defects, myelomeningocele, that can be operated on intrauterine, and those patients can have improved neurologic function post-natally once they're born. I think it's very important to build that rapport and achieve that level of trust with your patients, no matter who they are. And when it's the kids that we're talking about, it's not only the kid, but also their parents and their family members. And you have to realize that these parents are giving you what is most precious to them. It's something that we hold sacred, if you will. So you have to have that trust. And to be honest, when I meet with them, I typically try to talk to the kids first, right? No matter what age they are, you engage with them and you let them know that you're there to be their friend, to help them through whatever difficult time that they're going through. And of course, with the parents, we're taking care of their loved ones, so we let them know that I'm going to take care of them just the same as I would my own children. It's a trust that they've given me that I won't let go of. You have to be human. You have to remember that you're dealing with people at their most vulnerable. You have to be able to talk to them at their level and let them know that above all, I understand you're hurt, you've got these symptoms or whatever process is going on with you, and I'm here to help you.